All right. So, you've been sending us some really interesting stuff lately, and
Yeah.
this one um, that you pointed us to, this whole situation with the vaccine research funding.
Ah.
That's a big deal. Like we gotta dig into this.
It is. It's a huge development
Yeah.
and something that, a lot of folks are talking about, and rightfully so. I think,
Right.
we're talking about a really significant change in how the U.S. government is approaching, this whole area of vaccine research.
Yeah. Yeah.
And I think for this deep dive, what we really need to do is try to unpack,
Yeah.
what are the implications of these funding cancellations that we're seeing for all these vaccine related studies.
Right. And these are these aren't small little grants we're talking about, right?
No, not at all.
This is substantial.
Yeah, since January 20th, 2025,
Wow.
the Department of Health and Human Services, HHS, has just terminated a really large number of research grants. And what's really striking is that about 300 of those,
Out of how many total?
out of over 1,600, were specifically focused on vaccines.
Wow.
So it's a pretty substantial, redirection of resources in a really critical area.
It is, and it's not just, kind of like a general, across the board scaling back either, right?
Right.
This is targeted, it sounds like.
It is. It seems very targeted.
Yeah.
The information that you sent
Yeah.
really points to a very specific policy shift at the National Institutes of Health, the NIH.
Okay.
And looks like they've come right out and said that they will not prioritize research activities that focuses gaining scientific knowledge on why individuals are hesitant to be vaccinated
Yeah.
and to explore ways to improve vaccine interest and commitment.
Wow. So they're basically saying we're not even going to bother trying to understand why people are hesitant.
That's how it seems.
We're just going to, we're
Yeah.
just going to move on.
Yeah. And that's exactly right. I mean, while, research on vaccines as a whole isn't stopping entirely,
Right.
there's a really deliberate move away from trying to understand, those reasons behind vaccine hesitancy
Yeah.
and how to build greater public confidence.
Right.
And this shift, this is definitely, set ripples through the research community.
I bet.
I mean, we have this really compelling Viewpoint article in JAMA
Oh, yeah, I saw that one.
penned by 3 pediatricians who themselves
Wow.
received these termination letters.
So these are like, practitioners on the front lines
Right.
dealing with this stuff day in and day out.
Exactly. And what's their take on this? What are they saying about this policy change? Because, the news reports that we saw were suggesting, a pretty high level of concern.
Yeah, they're very concerned, and their warning is very stark. I mean, they flat out say that, the lives of individuals in the U.S. are at stake
Wow.
if this new
Yeah.
policy continues.
So they're not mincing words here. No, they are not.
This is
And they even go so far as to call this abrupt change, an astonishing about-face by the NIH.
astonishing about face. Yeah, what makes them say that? I mean,
Right.
what's the context that makes this feel like such a reversal?
Well, they point to the fact that we've learned so much, especially coming out of the COVID-19 pandemic.
Right.
About the huge role that vaccine hesitancy plays, in hindering public health efforts.
Right.
I mean, Dr. Francis Collins is a former NIH director.
Yeah.
He even came out and publicly said that he regretted
Yeah.
that they hadn't, addressed or understood vaccine hesitancy, more seriously earlier on.
Yeah.
So, to now be deprioritizing research
Yeah.
specifically, aimed at understanding and overcoming that hesitancy.
Right.
It feels like it's a direct contradiction of, the lessons that we've just learned.
It does.
And it's not just about, these specific research projects being canceled.
Yeah.
It's potentially about a shift in how the government is, fundamentally valuing these evidence-based public health strategies.
Right.
And, that carries a lot wider implications than just, these initial cuts.
Absolutely. And it seems like, what we're hearing from these researchers is that, this is really putting the U.S. kind of at odds with, what some major global health bodies are saying.
It is. I mean, the World Health Organization,
Right.
Going all the way back to 2019, identified vaccine hesitancy as one of the top 10 threats to global health.
Right.
And this really shows that there's a global consensus
Right.
on the significant danger that declining vaccine confidence poses to populations worldwide.
Yeah. And it's not even just, health organizations, right? You were
Yes.
telling me about a U.S.-based think tank that's looking at this at a whole different lens.
Yeah, so the Center for Strategic and International Studies, CSIS, they argue that vaccine confidence is actually essential for national security.
Wow.
And their reasoning, likely connects widespread disease outbreaks to, potential societal disruption and economic instability.
Yeah.
Highlighting that public health isn't just a matter of individual well-being,
Right.
but it's also a key component of national resilience.
It is. It's all connected.
Yeah.
And so we have, this global and national security perspective saying, hey, this is really important.
Right.
But then we see these cancellations happening, and it's like, wait a second, this isn't happening in a vacuum, is it?
No, it's not. The sources really highlight that these cuts are occurring against this backdrop of increasing vaccine hesitancy in the U.S.
Right. And it's significant. Like, how bad are we talking?
Well, a recent study estimated that around 1 in 5 parents in the U.S.
Wow.
now express hesitancy, towards vaccinating their children.
1,005.
That's a substantial number.
Yeah. And we're seeing this play out in real time.
Yeah.
I mean, with the resurgence of these diseases that we haven't seen in a while.
Exactly. We're seeing this troubling increase in cases of measles and whooping cough.
Yeah.
And Dr. Sean O'Leary, one of the JAMA authors,
Okay.
he uses this really powerful image he calls measles the canary in the coal mine for vaccine preventable diseases.
Oh, wow.
Because measles is so contagious.
Right.
And when enough people are vaccinated, it creates this kind of protective barrier, often called herd immunity.
Right.
That helps prevent outbreaks. But when those vaccination rates drop, that barrier weakens.
Right.
And that's when diseases like measles can resurface and spread.
Yeah, that's a scary thought.
It is.
And it's not even just these, historically childhood illnesses either, right?
Right.
I mean, we had a pretty bad flu season this past year too, right?
We did. The U.S. experienced, a particularly severe flu season recently,
Right.
with high numbers of hospitalizations and deaths
Yeah.
across, all age groups.
And so the experts are saying, what about that? Are they connecting that to the vaccination rates?
Yeah, experts are suggesting that decreasing rates of flu vaccination likely contributed to how severe this outbreak was.
Wow.
So we're seeing this potential correlation between lower vaccine uptake and the increased incidence and severity of all these infectious diseases.
Yeah. I mean, it's pretty clear that there's a pattern here, right?
Yeah.
Okay, so let's actually talk about, some of the specific research projects that have been impacted, by these funding cancellations.
Well,
Like, these aren't, theoretical, pie in the sky things, are they?
no, they are not.
These are real world studies with applications that can make a difference.
Absolutely. And Dr. Douglas Opal's experience, I think, provides a really clear example.
Okay.
His grant was focused on the really crucial work of understanding and increasing vaccine confidence, specifically within Alaska Native and American Indian communities.
Wow.
And this really highlights how these cuts can disproportionately affect our ability to address the unique health needs and concerns of these diverse populations within the U.S.
Right. And how did he react to this? I mean, this must have been a pretty big blow.
It was. He expressed, deep concern about the termination of this entire area of research.
Yeah.
And he's quoted as saying, this was a broad swath of work that was terminated, all focused on trying to understand the needs of individuals and communities regarding vaccines.
So it really speaks to the extensive scope of this.
It does.
Of the research that's been put on hold, right?
Right. And how it impacts our ability to really tailor those public health interventions to specific community needs.
Yeah, absolutely. And we also heard from Dr. Melissa Stockwell.
Yes.
What was her research about, and what's the impact of this cancellation on her work?
Well, Dr. Stockwell was investigating the effectiveness of using, text message reminders to boost childhood vaccinations for both flu and COVID-19.
Interesting.
And her team had already invested, significant resources.
How much are we talking about?
Nearly $1 million.
Wow.
And completed this pilot study.
So they were pretty far along.
They were.
Yeah.
And now this cancellation means that they can't proceed with the planned full-scale campaign and analyze the results.
Oh, wow.
And that's a really significant loss of, potential insights.
Yeah, I mean, it's pretty sobering when you think about, the impact, not just on the science, but on the resources, the
Yeah,
effort that's already gone into this.
absolutely. And she emphasizes that it's not only, this wasted financial investment
Yeah.
and this lost opportunity to gather, valuable data,
Right.
but it's also the broader impact on this whole community of researchers across the country whose, related work has also been affected simultaneously.
So this is like a ripple effect.
It is. It's not happening in isolation.
Right. Okay. So we've heard from the researchers. Let's hear from HHS themselves.
Okay.
I know you mentioned an opinion piece by Secretary Kennedy Jr.
Yes, in his opinion piece.
What did he have to say?
Well, he acknowledged the protective benefits of the MMR vaccine
Okay.
and its contribution to what he called, community
Immunity.
And by that he's referring to the idea that, when a high percentage of a community is vaccinated against a contagious disease,
Right.
it protects even those who are not vaccinated.
Mm-hmm.
Yeah, like infants or
Okay.
individuals with compromised immune systems.
Right.
However, now Secretary Kennedy Jr. notably emphasized that the decision to vaccinate is a personal one.
Okay.
And he stopped short of offering, an explicit recommendation for vaccination.
Interesting. So he's kind of, acknowledging the public health benefits,
Right.
but then also really putting the emphasis on individual choice without really, saying, hey, you should go do this.
Right. And it reflects a particular stance, on personal autonomy.
Yeah.
But it stands in stark contrast to, that strong public health imperative voiced by the researchers
Right.
whose funding has been cut.
Right. And those researchers, they seem to interpret these cancellations as more than just, budgetary adjustments,
Yeah.
right? They're seeing it as a fundamental shift in the government's approach to the role of science in safeguarding public health.
Yeah, they're arguing that these cancellations represent an endorsement of an approach to deprioritize science, no matter how fundamental that science is to the health of individuals in the U.S.
Wow.
They see it as a devaluation of the very scientific inquiry
Right.
that's needed to understand and effectively address a significant public health challenge, and like vaccine hesitancy.
And they bring up another interesting point too, right, about
Sure.
the economic impact of this.
Right. They suggest that, while there might be some immediate cost savings from cutting these research grants,
Uh-huh.
the long-term economic burden on the U.S. could actually be, it's significantly higher.
Yeah.
Because vaccines are widely recognized as one of the most cost-effective public health interventions that we have.
Right.
They prevent costly hospitalizations.
Yeah.
They reduce lost productivity due to illness.
Right.
And they contribute to, overall longevity and well-being.
It makes sense.
And there's even a statistic from this pro-vaccine nonprofit, Vaccinate Your Family,
Okay.
stating that every dollar invested in childhood vaccines saves roughly $10 in healthcare costs, later on.
Wow.
And that really underscores the potential, for long-term economic repercussions.
So it sounds like, they're saying this could be a case of, being penny wise and pound foolish.
Exactly.
Yeah. So what is the NIH actually saying about this?
Right.
I mean, how are they justifying these funding cancellations?
Well, the termination letters, they state that NIH is obligated to carefully steward grant awards to ensure taxpayer dollars are used in ways that benefit the American people.
So their rationale is basically, we're trying to be responsible with your money.
Right.
Okay.
But Dr. Opal's reaction to that justification is really telling.
What did he say?
He described the NIH's stance as chilling
Wow.
and reiterated the absolutely unequivocal importance and benefit of vaccines to the American public.
Yeah. So it sounds like there's a real fundamental disagreement here
There is.
about what constitutes, a benefit to the American people in the long run.
Right.
Yeah. So as we kind of wrap up this deep dive, we're seeing this really clear tension, right? Between, HHS saying, hey, we're just trying to be responsible with taxpayer money.
Right.
And the researchers saying, wait a second, this is deprioritizing crucial scientific inquiry
Right.
into something that's really important, for public health and could end up costing us more down the line.
Exactly. And the sources that we've explored, really paint this picture of a potentially significant departure from, those established public health strategies
Right.
with uncertain but potentially far-reaching implications for vaccination rates.
Yeah.
And the resurgence of these preventable diseases.
Right.
And, this reduction in research that's aimed at understanding and addressing vaccine hesitancy could really weaken public health efforts
Right.
at a time when maintaining high levels of vaccination is arguably more important than ever.
This is a big deal. And so, listener, we're really curious to hear what you think.
Okay.
Given everything that we've just discussed, what do you believe is going to be the most significant long-term consequence of this shift in vaccine research funding?
Yeah.
What other questions does this raise for you about the balance between individual choice and these broader public health priorities? It's a really complex issue, and we hope that, this deep dive has given you a little bit more clarity on the different angles that are at play here.
Yeah, I think it's important to keep these conversations going
Absolutely.
and to really, consider all sides.
Keep those questions coming,
Yeah.
and we'll see you next time.
All right. Thanks.